And while a small group of Arizonans have gotten the coronavirus vaccine so far, we know you have a lot of questions. And our panel of experts joining us now to answer as many as we can get to from our viewers. And let's start with the basics. The first question coming from Richard H. And he's asking, what will the vaccine do? Does it stop me from getting COVID-19, lessen the severity of the symptoms when contracting COVID-19? Dr. Marvasti, can you answer that one?
Yeah, I'm happy to. As of now, the data that we have for the Pfizer vaccine is that it basically, the 95% number is after the second dose. And what it does is it decreases the severity of illness from COVID-19. So it doesn't, we still don't have data to know whether or not it actually helps to prevent spread or prevent you from getting it or giving it to others. But even if that ends up just being the main thing that it does, it's a big deal, right? Because it keeps you out of the hospital and can keep you from potentially dying. Now, the new data that's coming out with Moderna, they've started to look at this. Pfizer's still looking at it. These are still being researched. We just are getting emergency use right now. So we're going to continue to collect more data. But the Moderna vaccine is also showing some early data that shows that it may also decrease asymptomatic spread. So we'll see kind of what pans out with that one, as well as new data that may emerge about that. But for now, we know that it is definitely protective at keeping you from getting severely ill from a COVID-19 infection.
Another question, and again, this is back to basics here. Nancy E. from Golden Valley asking, what are the ingredients in the vaccine? Dr. Akhter, what's in this stuff?
Yeah, this vaccine is kind of amazing in that the main component is the mRNA, as I'm sure you all have heard, which codes for the spike protein. But unlike the other vaccines, for example, the flu vaccine, which has other substrates, whether egg or otherwise, this vaccine is basically just enveloped in lipids, which is basically fat or cholesterol, and salts like potassium chloride and saline. And so in some sense, it's the mRNA, which is novel, enveloped in things that your body's already used to. So we think that the side effect profile, including allergies, should be very, very low. Now, of course, some of those components maybe will have allergies to, but basically, the amazing thing about this vaccine is that is basically in substrates that our bodies, almost all of our bodies, are very, very used to.
Will, we've heard from a lot of people about side effects, and given after the vaccine, Cheryl T. asked, should we not consult with our family doctors and specialists first before we receive this vaccine? She's concerned that the vaccine's not a one vaccine fits all. It can have very serious side effects for some people. I think generally the rule is talk to your doctor if you have any concerns about conditions that may conflict with this.
Absolutely. Always talk to your primary care doctor if you have any questions. They're really accessible right now because they understand what the questions that their patients have. So yeah, definitely have a conversation with your doctor. Primary care docs are staying up to speed on everything that's happening, and they can, talk you through it. And like Dr. Akhter talked about, if you've got a history of allergies, they can, help you address that. And so that's always the best thing. I just want to address something Dr. Akhter said too, is that one of the things we saw in the clinical trial data with the Pfizer vaccine is the people that got the placebo, so that's the people that didn't get the vaccine but just got like a saltwater injection, they had similar side effects than the people who got the actual vaccine. And so when you talk about the side effects from the vaccine, you have to keep it in context that the people that just got saltwater got very similar kinds of side effects.
Yeah, sometimes it's just getting the shot itself. Liz M. writes in, I am not able to take a flu vaccine due to a medical condition. Is the COVID vaccine similar to the flu vaccine? Dr. Akhter, can you answer that one? They're different vaccines, but this person may have some other issues that need to be addressed.
Yeah, so the first answer I would say is always discuss with your physician. In this case, I'm not sure what that medical condition is, but I will say that the flu vaccine is very different from the Pfizer and Moderna vaccines. And so in general, if you look at the recommendations, whether from the CDC or otherwise, people who aren't getting the flu vaccine doesn't necessarily mean they can't get the COVID vaccine. In fact, a lot of people will get the COVID vaccine who may not be eligible for the flu vaccine because of allergies or otherwise. Of course, this is very patient dependent, and it depends on what your side effect profile of the flu vaccine is. So always discuss with your physician. But I would not make the categorical statement that if you don't get the flu vaccine, you can't get COVID. On the contrary, you very well may be able to, and it may be recommended.
Dr. Akhtar, Dr. Marvasti, Will Humble with the Arizona Public Health Association. Thanks for talking with us. We'll check back with you in a few moments with even more questions from our viewers. Faye?
All right, well, beyond just questions about the health side of the vaccine, many of you also reaching out asking how the state will get each dose of the vaccine where it needs to go without delays. That's what we're going to discuss next with Wendy Smith-Reeves. She's our ABC15 analyst and the former director of emergency management. Wendy, thanks for joining us. First question focuses on how the state is ensuring that there are enough doses to go around. So Morgan Kay asks, how does the state know how many vaccine doses to order, and what happens if we order too much or too little?
Great question. So we know what our census population is, and we also have a lot of data sources that tell us what the demographic groups are that we've categorized into the 1A, B, and C, and then groups 2 and 3. So understanding what the total need is for Arizona, and also these manufacturers are going to be shipping this in finite quantities, so it's not like we're getting all that we need at one time. It's going to be coming in waves. So we're never going to have enough because right now, if you look at the timeline for Group 3 is estimated to be eligible to receive a vaccine in the summer. So it's that steady flow that we need, and then pushing it out to all of the areas within the state based upon the demographic population groups that we've already identified.
So Wendy, on that same note of vaccine shipments, Millie P. from Sun City wants to know, how does the state actually track shipments of the vaccine? Is it like you or me when we have a UPS package that we can track it online?
So there is tracking information that's provided to each state once a shipment has been sent out, or to the provider that is to be receiving that package. So they understand what the timeline is and the expectation on when it will be received, so they can receive it and get it into the proper storage temperature that they need it to be as quickly as possible. The manufacturer has designed packaging that ensures that it can get to its final destination and be maintained at the proper temperature before it can be placed into the freezers once they arrive on the site.
And with those deliveries, Wendy, Wanda from Goodyear also curious about this. What quality control measures does the state have in place to make sure the vaccines arrive in good condition?
Absolutely, that is vital to ensure that the vaccine that we receive can actually be distributed to individuals. So there is a QA/QC process that the manufacturer would already have established, and they would have been providing that information to the providers that are going to be receiving that vaccine. And then there's a double check once you receive it to ensure that it has met all of those qualifications, and you're giving that feedback back to the manufacturer so they understand that what you received was in proper condition and it is available to administer to patients.
Yeah, so critically important. Wendy, thank you so much for your time. And a reminder, we have a dedicated section on our website for vaccine information. You can find it at abc15.com/vaccine.